Good afternoon. I'm Dr. Duke Majan. And it is, pardon me, September 23rd, 2025. Our patient has lower back pain. It's coming from the sacroiliac joints. It's a joint where your tailbone connects to your hip bone. All the weight of your body from your waist up gets transmitted through the right and left SI joints. And over time, after injuries to the joint, sports injuries, falls, whatever, car accidents, we end up getting arthritis in those joints. Arthritis is basically inflammation. Inflammation is painful in a joint, just like knees, hips, shoulders get arthritis. They hurt when you use them. So he has this SI joint pain, and on both sides, we're going to go in and treat it. Are you ready? Yes, wait? Yes. All right. We're going to get started. We're starting with the left side. I apologize. Henry, will you show the audience how we treat the sacroiliac joint pain?
Of course.
Sacroiliac joint injury is a common cause of chronic back pain. The inflamed sacroiliac capsule tear generates pain signals. The best treatment for sacroiliac joint pain is the Duke plasma rhizotomy. Sacroiliac joint pain nerves are destroyed. The advantages with the Duke plasma rhizotomy is that it's an outpatient procedure that takes 30 minutes to complete, very minimal bleeding and pain after the surgery with immediate recovery and return to work the next day, as well as a 99% success rate and permanent pain relief with a single treatment. For more details, please visit our website at www.dukespine.com or call us at 1-800-FIX-MY-BACK, 349-6922.
All right, welcome back. Once again, our patient has sacroiliac joint pain, and we are attempting to fix it for him. Now, his SI joint anatomy is a bit unusual. Why? Because I'm feeling around with my probe, and it just feels like he has, I apologize, either a tendon that is calcified, like a ligament or tendon that's calcified. I'm trying to get to the deep part of the joint. Sean? We don't want to go through the foramen. We want to stay lateral. Sean? So that's what I'm working on, is getting to the lateral part. I think we're there. Yep, there it is. You can see that. That's very nice. Shot. Any questions, Sean?
At this moment, no current questions.
I think I understand what's happening. If you look at the medial surface of his iliac bone, you can see there's, show them the medial surface. Yeah, come down. Look at all that irregularity. That's all calcified ligament. That's why we're having trouble. His ligament is all calcified. Shot. And it's literally pushing me medially. Shot. Making it difficult to get this thing done. Shot. Shot. I'm not giving up. Shot. That's perfect right there. That is the perfect spot to go in and get that pain nerve. Shot. Again, I'm being deflected again by his anatomy, meaning being pushed over to the side. Any questions?
At this moment, no current questions.
Shot. That's me. Shot. I'm trying to be as aggressive as I can be safely. Shot. Oh yeah, that's nice. I think that's as much as I can do. I want to try to get down a little bit. Let's change the tip. I'm going to try to get a little further south. I'm happy with the north. The south, I want to get a little bit more. South means down by the feet. Shot. That's too far south. Shot. Shot. That's the tail end there of the joint. Quite literally the tail end. I just felt one of those pain nerves right there. I think we got it. I think I just literally just got it. That was amazing. Could feel it. That was great. These pain nerves you can actually feel, like once you get used to doing these procedures. Let's go to the other side. I'll put some pressure. Let me have a roll. And shot. Shot. Yeah, I like that. I think that's right there is pretty good. Yep. Nice. We're going to go to the right side. I'm happy with the left side. I felt like we got what we needed done. I'm going to go back to the other side, his right side, and see if we can't do the same. Again, I'm dealing with a calcified ligament here. That's what we're encountering. So there's a ligament that holds the sacrum to the iliac bone, sacroiliac ligament. Move your hand, Shot. And that's what we're dealing with. That ligament in people, certain people like with bad arthritis of the joint, Shot, then it ends up getting calcified, which means that it basically gets hard. It gets really hard to deal with. And surgically, it makes it very difficult for me to get in there. Shot. And get the joint fixed. Treated. Shot. That's good. Yeah. That's the top part. Feels good. Got in there. You can feel the crunchiness of that calcified ligament. Got to go through it. Shot. Got to get to the deep part. That's where the deep part is. The deep part's where those nerves are. And that's what I told them. I was going to go as deep as I can go. All right, so I'm going to go south a little bit. We're almost done. About 2 more minutes. Any questions? Sean?
Yes, we just got a question coming from Thomas on
Hi,
YouTube.
Tom. Oh, one more.
Asking,
Yes, Tom.
when a pressured nerve has been relieved of a bulge, how long before the nerve comes to, quote, life again? Or does it take a substantial amount of time to heal up?
Well, Thomas, you said?
Thomas, correct.
Thomas. Great question, Thomas. Absolutely great question. You are correct. The nerve does not start working right away, unfortunately. It takes time. And how much time? It can be a year, it can be 2 years. I've seen it take, typically, it will be about 3 to 6 months, but I've seen it take over a year in some cases. Sean? All right, we're done. I'm pretty happy.
Thank you.
Hopefully that worked. But both incisions are 4 millimeters, tiny. There's really no bleeding with this surgery. And we put a little bit of medicine to reduce some inflammation, but that's it. We're going to take the bandage off and put 2 little staples, and he's going to go home. Come back tomorrow for a wound check, and then be done with this, hopefully, for the rest of his life. You can see how tiny the incisions are. I think we lose about maybe 3 or 4 drops of blood per incision. It's bloodless surgery, honestly. And the alternative, a lot of doctors will recommend fusions of the SI joint, but fusions don't work. They've proven that they don't work. All right, Henry, any other questions? If not, let's go ahead and show our audience one of our patients who had treatment here at Duke's
We
Spine.
have one very quick question coming from Thomas once more on YouTube, asking, what is the best food to eat nutritionally after Duke laser disc repair?
So nutritionally, I would just say a well-balanced diet with lots of vegetables, fruits, and protein, some carbs, just a good, healthy, well-balanced diet. That's it. As long as you have protein in your diet, you're going to give yourself the best chance of healing that annular tear. And then also vitamins and minerals, right? Which most food, if you have a well-balanced diet, contains vitamins and minerals. All right, thanks for joining us. Have a wonderful afternoon. We'll be back with our final surgery in about 20 minutes. And good morning. I'm Dr. Duke Machen, CEO and founder at Duke Spine Institute here. I have a patient who came to us with severe, debilitating pain coming from below his spinal fusion in his lower back. He had sacroiliac joint pain on both sides, and there was no getting rid of it. There's only one treatment that works, and it's the Duke plasma RHIZOTOmy, offered here at Duke Spine. It's now patented, and it's FDA approved. His insurance approved the procedure. He had it done yesterday. How do you feel today?
Great. That 99% better than I felt 2 days ago. Not kidding you.
And are you on pain meds?
No, I'm not.
Did we put you on some new meds that took away your pain, or is this from the procedure we did?
This is from the procedure.
And we did it less than 24 hours ago. Here you are, back here. It was outpatient. Your pain is gone. You're not on any medication. There was no bleeding, no hospitalization necessary, and 2 tiny little 4 millimeter punctures on the skin. You happy?
Oh, absolutely. I'd give you a kiss if I liked you.
You like me.
I
You
know,
already
I
gave me a
know.
hug.
I
But
know, I
kisses
do.
are off limits. My wife is the only one. My kids. That said, I've known you for a long time.
Oh,
We did your fusion many years ago. Because of the fusion, you wore down those SI joints pretty quick. So that's why we had to do your procedure. Very common in patients with fusions in their backs, they get what's called adjacent segment disease. And what that means is when you fuse a part of your spine that's meant to be bending and twisting, then that puts strain on other joints above and below, and they wear out faster. We do not recommend fusions on anybody, or laminectomies or discectomies, because they lead to fusion. We did your fusion many years ago.
oh yes.
Your insurance did not want to do the laser. They only wanted to do the fusion, so we did it. And now we're dealing with some of the sequelae of that, right?
Yeah, workman's comp was tough.
And people say work comp patients don't get better. Is that true?
Oh no, depending on what doctor you have.
That's right. And what treatment you have.
Yeah, absolutely.
If you have the right treatment, work comp patients get better. Isn't that true?
That is absolutely true.
Is there anything you want to tell your fans out there?
I'd like to start out by telling you in 1982 is when I first had this situation happen during a 5-car accident. And I've been living with pain forever, seemed like. Today I don't have any pain. I mean, I just don't feel any pain. That's how far I've come, along with this man, of course. Without him, I don't know what I'd have done or what I've done. One nurse one time gave me go see Dr. Duke. He's the best. Well, he is the best. Thank you.
You are why I do what I do, to
Thank
help
you.
people just like you, suffering, to try to give you some decency and quality back to your life.
Even all the complaining, I said, I don't want it, I don't want it, I don't want it. You kept talking me into it. I'm glad you did.
You're
I'm
welcome,
glad
my
you
friend.
did.
You're welcome. Enjoy your life.
Oh, I will. And you too, huh?
Thank you.
You're a good guy.
Thank you. I appreciate it. All right, let's get you out of here.